Before we explore the substance of our policy, first we will begin by understanding the context and motivations that lie behind the proposal. University students haven't always been at the forefront of pandemic policymakers' minds. However, their role in the pandemic has featured in newspaper headlines covering a range of different concerns. For example, the uncertain impacts to students of educational disruption, travel concerns relating to students returning home for holidays, as well as the impact university students have on regional economies, local businesses, and risk levels. We know that young people face very low rates of hospitalisation, if unfortunate enough to contract coronavirus, and an even lower mortality risk. This is reflected in the ONS data displayed here, where the risks to older people are far greater than to younger cohorts. This knowledge creates a potentially interesting behavioural response dynamic in low-risk individuals, in this case specifically university students, who carry out pandemic guidelines, restrictions and health-preserving behaviours largely for the benefit of other people's health, as opposed to a direct threat to their own. From an economic perspective, adherence to guidelines is essential to the undisrupted running of universities, businesses, public transport, etc., that students are so reliant on. Despite these widely acknowledged realities, there is a danger that low-risk, less vulnerable individuals may experience decreased urgency to maintain informed on the progression of the pandemic and to engage with the vast quantities of information that accompany its development. Empirical evidence has documented risk attitudes of young people who are often less risk-averse than older adults. Young people's risk behaviours may result in complacency and poor perception of risk for themselves and those around them, which when aggregated over university students across the country could have significant implications on pandemic outcomes. Consequently, we have identified a need for a public information campaign targeted specifically at university students. The campaign will provide salient information in a concise way, with incentives built into the policy design that ensure that students are engaging with relevant, accurate information that will help inform their behaviour and decisions in response to the current state of the pandemic. We think this format will be an effective way of reaching students, and if successful, this approach may be adapted should another pandemic arise, and can be kept as a useful tool in the toolbox of pandemic policies.
Our proposed policy of a nationwide survey would mainly be aimed at students in higher education in the whole of England and would likely have to be a united effort between the Department of Education and the Department of Health. We believe that the best organization to head this effort would be the Office for Students. The Office for Students is a non-departmental body that falls under the Department of Education and has as one of its main goals helping higher education students to stay informed. It also has a direct experience with organization of a nationwide survey, as it runs the annual National Student Survey, so it should be more than capable of handling this campaign as well. The content of the survey itself would be based on information provided by the Department of Health to ensure it is appropriate and accurate. These two organizations already have experience working together on projects such as the Mental Health Funding Competition, aimed at funding projects improving students' mental health, which will further facilitate their cooperation. These two organizations already have experience working together on projects such as the Mental Health Funding Competition, aimed at funding projects improving students' mental health, which will further facilitate their cooperation. The higher education providers also have experience with working with the Office for Students on a survey of this size, so the rollout should be as smooth as possible. Not only will the universities and colleges have to participate if the policy comes from the Office for Students, but it will be in their best interest to do so, as it will help ensure that their students are as informed as possible and thus less likely to participate in high-risk behavior. This would mean that the education provided by them can continue without stopping or moving online, thus saving them any extra expenses. The Department of Health will gain from more informed students, as the information will help to reduce the overall number of cases and transmissions. Therefore, we believe that the Office for Students is the best equipped governmental organization to head and implement this policy, as it already has experience with similar projects of comparable scale, is used to working with both the Department of Health and all of the higher education providers, and this policy is a mutually beneficial one so that all parties are more likely to participate fully and willingly.
Okay, then the part is policy design. The policy is an engaging information campaign executed through interactive surveys. The contents of the interactive survey should be clear and less time-consuming, and preferably can be conducted online due to the aim of decreasing virus spreading. Such surveys could be performed regularly. For example, they could be carried out every 2 to 3 weeks. Surveys can begin by informing participants of the latest adjustment and new policy introduced by the Ministry of Education or the Ministry of Health, based on the diagnosis of the pandemic. In most cases, these new rules were issued after thorough discussion of consequence by relevant departmental think tanks. Of course, if from a student point of view, this update has negative consequences that the policymakers did not anticipate, the students can give you feedback through the Office for Students. Key questions in such surveys could include personal intentions, including whether students were willing to wear masks indoors, what additional facility were needed to control the spread of pandemic, whether students were willing to combine online and offline classes, what action students would take if affected, and what support they would like from the university, etc. When conducting surveys, students should be given appropriate incentives to increase participation and motivation. For example, small monetary rewards like discount for the university bookshops and extra credit for relevant courses can be a good motivator. We all know that there is a considerable lag in the transmission of information, and it is difficult to keep policymakers and implementers on the same page. Consequently, regular checks and up-to-date guidance within the information campaign can help bridge the gap between policymakers, those who assist in implementation, and those who implement.
Evaluates the potential cost and income of the policy through cost-benefit analysis. The sheer scale of this campaign dictates that it requires both human and material resources. The Ministry of Education and the Ministry of Health should have specific funds allocated to ensure its smooth implementation. For the Ministry of Education, providing stable and high-quality education is the main objective, and we believe this survey will help achieve that. The main cost includes incentives. Distribution cost we'll discuss later. The potential costs stem from additional facilities based on feedback. This may include plastic dividers, hand sanitizer, free pandemic prevention medication for students, additional staff to conduct contact tracing of infected students, and regular disinfection of public facilities such as library computers, printers, and table, etc. In this context, it is important to ensure that students are informed and sensitive to the latest measures to control the epidemic, which has had considerable impact on their learning environment and mentality. For the Department of Health, avoiding the spread of virus and decreasing the possibility of catching pandemics are priorities. The information campaign would help to get these problems under control and supervise the process. Overall, we believe that the benefits of the policy will outweigh its disadvantages. Firstly, they can save people from grave disease and death. Secondly, it will enhance the reputation of the universities, increase the number of students, and ensure the quality of teaching and learning, which will lead to more research and academic achievements. It should be noted that the economic development of country depends to a large extent on the level of education of its people. The primary aim of this policy is to retain students in schools, reduce the number of dropouts, and ensure more face-to-face teaching and offline examinations in order to maintain the authority of academics and the quality of diplomas.
There are also potential policy limitations to consider. We have identified 3 areas most prone to limitation. I will outline our strategy to mitigate these potential issues. First, student engagement level. Intuitive concerns may raise the question of how likely students are to actually engage with the content, in the context of being the lowest risk or least affected party. As a result, is the cost of the survey worthwhile relative to the effect? Our policy is well placed to answer this question for 2 reasons. Due to the important nature of spreading information to young people, specifically students, as previously outlined in our policy motivation, we would argue that in terms of reaching all students, an interactive approach pursued through higher education facilities is the most far-reaching. It guarantees that each student will receive at least a notification and a starting point for interacting with the information. Furthermore, studies have shown that online content in conjunction with credit offerings, quote, produces significantly higher submission rates, end quote, Williams found in 2016, and as a result, it is incorporated into our policy design. Secondly, another potential limitation is the extent that the positive effects are replicable. One motivation of the policy was to gauge its effectiveness as a tool in potential future pandemics. The impact on students' life from COVID may make them either highly willing or unwilling to partake in a survey, and that may skew our understanding of how effective the policy is at a baseline level of spreading information. We postulate, however, that the detrimental effects on society over our level of unpreparedness, the cost associated with determining any sort of starting point of a potentially highly effective distributive information tool is a worthwhile cost. One final limitation to consider is the cost evaluation of the targeted information campaign. The primary consideration of our cost-benefit analysis is our determination that the policy will be relatively very low cost. Figures from the Cabinet Office show that the government spent £184 million on communications relating to COVID-19 in the year 2020. In comparison, the Office for National Statistics, with a budget of £5 million, carried out 1,024 statistical releases in that year, including 224,000 households participating in their COVID infection survey. Furthermore, our suggested policy distribution structure would already be in place, with universities forwarding our informational services, thus reducing the cost. Accounting for all these variables and general market research, we would not expect this cost of the survey to rise anywhere above £50,000. Comparing this figure with the large sums spent by government on COVID communication holistically, we established that this policy is very low cost. The benefit of this policy we put forth is the balance between low-risk individuals acting differently alongside a, quote, need to extend knowledge base among individuals, end quote, as cross-paper scholars argued in late 2021. Additionally, the Labour Shadow Health Secretary stated in mid-January 2022, quote, we're not out of the woods with COVID-19. The virus will change and adapt and we need to learn to live with it, end quote. In this context, we believe it's crucial that young people remain informed about the pandemic in these latter stages. Moreover, the benefit of this policy tool lies within its adaptability and scalability to maintain high levels of comprehension in varying situations among potential new waves, which we believe is highly worthwhile at our planned low cost. If a significant increase in cost were to occur, one could potentially argue such a policy is not the most productive use of funds. However, we are confident that the cost range of the policy is sufficiently low and current and future benefits are such that the policy remains valuable. In conclusion, we have put forth a public information campaign targeted at students, specifically taking advantage of information spreading opportunities highlighted in the Banerjee 2020 paper, and we believe the benefit of ensuring information is spread to this low-risk group during latter stages of the pandemic and establishing this policy tool's effectiveness for future pandemics is a strong policy with beneficial outcomes for relatively low cost.